Hello, scholars. My name is Dr. Kara Stillen, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the like button and the subscribe button because it helps to make videos much quicker. In the last video, we talked about disinhibited social engagement disorder. In this video, we're going to look at post-traumatic stress disorder. In order to be diagnosed with post-traumatic stress disorder, PTSD, the individual must be over the age of 6 years old, a child, an adolescent, or an adult. They must also have the following characteristics. A, the individual must have had exposure to death or an actual death, some sort of serious injury, or sexual violence. A, they had to directly witness the trauma, or B, witness the event as it occurred to others. C, just learning that a traumatic event occurred to a close family member of a friend. The event could have been either accidental or violent. Or D, they experienced repeated or extreme exposure to seeing or hearing the bad details of the traumatic event. B, there is the presence of one or more of the following intrusion symptoms that go along with the event that will eventually begin usually after the traumatic event occurred. A, they have involuntary, recurrent, and intrusive negative memories of the traumatic event. B, they may have dreams in which the content may be similar to what they experienced or they witnessed. C, the individual may have flashbacks in which the person may feel like the event is happening right now. Or D, the individual might have intense or long psychological distress when exposed to things that could represent the traumatic event. Or E, the individual can have physiological reactions which are triggering of the traumatic event. C, many people will try to stay away from the stimuli associated with the trauma. This can include A, the individual will avoid memories, thoughts, triggers, feelings, etc. that have been associated or that they have associated with the event. B, they will avoid people, places, activities, conversations that are related to the traumatic event. And then D, there are negative alterations in cognition and mood that come from being around the traumatic event, beginning or being worse when near the traumatic event. So within that, it might be impossible to remember an important aspect of the traumatic event. B, they may not remember it because they have negative expectations about themselves and trust in their own memory. C, they may have persistent or distorted cognitions about the cause or consequences of the traumatic event that could lead the person to blame themselves. D, they may have fear, horror, anger, or guilt over the incident. E, they may have no want to participate in like activities. F, they may feel like they don't want to be around others. And G, they may have trouble feeling happy again no matter where they are in their life. E, there are marked alterations in arousal and reactivity associated with the traumatic event, beginning or worsening after the traumatic event as evidenced by at least 2 of the following symptoms. A, angry outbursts or irritability because of repression of the traumatic event. This can mean physical aggression toward others. B, reckless and self-destructive behavior toward the self. C, hypervigilance, always knowing what is happening around you. D, exaggerated startle response. E, problems with concentration issues. F, sleep problems. This lasts more than a month. G, these problems cause impairment in social, occupational, and other important areas of functioning. H, these symptoms do not come about because of alcohol or other substances. The professional will want to specify if they have dissociative symptoms, they meet the criteria for PTSD and they meet the criteria for 1, depersonalization, which means occasional or all the time feeling detached from their own body, as though they were on the outside looking in, like being outside of a dream looking in. And 2, derealization, that one's surroundings are not real or they feel like they're part of a dream. They also want to specify if there is a delayed expression. So let's say a person goes through something and it takes a while for them to feel things. There are many different types of traumatic events that can lead to PTSD, including war, threatened or actual physical assault, robbery, mugging, sexual abuse, alcohol, drug facilitated sexual penetration, being taken hostage, sexual trafficking, being kidnapped, natural disasters or man-made disasters, torture, a life-threatening illness, waking up during a surgery, domestic violence, war or disaster, or viewing a medical catastrophe. And that list can be added to as well. A traumatic event can be re-experienced in many ways. Usually there are common and recurrent involuntary and intrusive recollections of the event. These events can be relived for seconds, for hours, or even days. Stimuli with the trauma are almost always avoided. There can also be a host of ways that people deal with their trauma. So they can become verbally aggressive, they can startle quickly, or they just want to get out of the situation as quickly as possible. They may have trouble remembering daily tasks, or they may have trouble figuring out what time it is. They also may disassociate from their bodies or try to dissociate from the world around them. People may have trouble regulating their emotions as well. In the United States, the risk of PTSD is 8.78% per year. For just adults, it is 3.5%. PTSD can occur at any age. Even babies can experience trauma, so symptoms will tend to appear about 3 months after a traumatic event occurs. There can be delayed expression. So how long it takes a person to completely recover from PTSD can be anywhere from 3 months all the way up to 50 years, or they experience that with their whole lifetime. It all depends upon the person's brain, the formation of the brain, the amount of therapy that they have, and the environment that they are around. So keeping yourself healthy and having a balanced lifestyle is one of the best ways to combat PTSD. Now, there is a heightened risk of suicide and suicidal behavior with those that have experienced PTSD. People with PTSD are 80% more likely to have other mental disorders such as bipolar disorder, substance use disorder, and/or anxiety. If you yourself or someone around you has gone through a very traumatic event, please ask for them to go to therapy and to get help with what they're experiencing. They might think that therapy is for people that are weak or weak-minded, and that's just not the case. Therapy is for the healthiest of us all. All right, well, that is the end of our video. I hope you liked this video, and I hope you also found it useful for your studies or if you're just learning more about PTSD. Thank you so much for being here, and I will say goodbye, and I will talk with you soon.